Welcome back to KUTV Prime Time News, and you can catch us on our social media handles. We are at KUTV_Kenya on Twitter, KUTV Kenya on Facebook, and streaming live on YouTube at KUTV Kenya Live. Now, to our discussion of the day on tuberculosis. Now, TB is one of the world's deadliest infectious diseases. In Kenya, it has retained the same attribute. According to the latest data from the Health Ministry in the year 2020, which was when the COVID-19 virus dawned in Kenya, 72,943 cases were diagnosed with TB, 8% being children. 21,000 people died, 4 times the number of people who have died from the COVID-19 virus since the pandemic began. The disease is airborne and can lie dormant in someone infected with the bacteria, but I won't go into much of the details on this. As for this, we are joined by one adept with this, Dr. FRANKLINE MUTEMA, a TB, leprosy, and lung disease specialist. Dr. Good evening.
Yes. Yeah, good evening.
Yeah, welcome to the broadcast tonight. As we break into matters TB. Today is the World TB Day.
Yes, today we commemorate the World TB Day. It is usually celebrated every 24th March of every calendar year.
And maybe you could be able to brief us why was the 24th of March selected? Why not any other day?
Actually, for the guys who love history, I think we commemorate the day. One of microbiologists, a German called Robert Koch, diagnosed this bacilli sometimes in the year 1882. So we usually commemorate that day in the presence of the current disease phenomena, so that at least as we remember it, we also create awareness about tuberculosis and also lobby for more support or resources to be able to create awareness among the population.
And Dr. For one not conversant with it, could you break it down to us on what tuberculosis is and why it is a disease of concern? Why even have a day for it?
Okay. Well, thank you very much. Actually, tuberculosis is a disease of importance to our lives. And the first thing I would say that TB is an infectious disease. Infectious meaning it can be transmitted from an infected person to another infected or uninfected person. And it is caused by a bacteria, which is called Mycobacterium tuberculosis. We have varieties of tuberculosis, but of Mycobacterium, but of specific for human is Mycobacterium tuberculosis. This disease usually is spread through airborne, just like COVID, airborne droplets, where somebody can breathe in and get infected when somebody coughs, sneeze, laugh, or even talk as we are talking, or even sing. And this disease is usually one of the most dangerous, as you have alluded earlier. It is one of the leading killer among the infectious disease in the world. And you can see the numbers in Kenya, 21,000 people having died worldwide last year.
Indeed, very
well. And
I
remember, it's actually been ranked as the leading cause of death among people living with HIV also. So it's usually a very, very dangerous disease to care about, investing and making sure that human population is not affected by the same.
And Dr. could you take us through the diagnosis process? How would I know if I have TB?
Okay. First of all, sometimes when somebody gets healed, there are usually signs and the symptoms they present with. And at home, you realize that somebody is having a cough. And when we talk about cough, we are saying cough of any duration. Somebody could be having hotness of the body. Mostly the doctors will call it a fever, weight loss, and drenching night sweat. So people sweat at night, yes, but at this time, when you sleep, when you're waking up at night, your beddings are actually wet out of sweat and unintended weight loss. Others may present with other symptoms like a chest pain. Somebody can cough, produce a sputum, which is actually blood stain. And in children, there is failure to thrive. They don't have actually weight. It is either started weight or they start dropping in weight. So when they have these signs and symptoms, they come to the hospital. Our clinicians are able to take a good history and examination. They would request a patient to give us a sample, obviously the sputum, which is subjected for testing. This is what I was saying was discovered initially in 1882. But as to be able to progress, we are doing more other advanced tests. But initially we could take 2 samples or sputum, which is tested using either a light microscope or a fluorescent microscope. But currently we are using molecular tests like a gene expert, which is a test now which can be able to give you results within 3 hours, unlike the microscopy which we are getting within 48 hours. And this has actually made us to be able to make more diagnosis earlier and to be able to save more lives within our country and world at large. So when we take that sample for the tests, we are able to diagnose and put you on treatment on time. Other tests we can be able to do, we also do various x-rays. You can do a chest x-ray or even a CT scan for that matter, so that we can be able to see that the damages which have been caused by the mycobacterium into the lungs. And other blood tests doctors can undertake to confirm that there is a TB infection in someone's system.
And Dr. Are these tests that you've been able to put across, are they tests that are like, they are available to the common mwananchi? Are they available widespread all over the country, with the status actually being worrying? Because when the case is like a full-blown situation like this one, the screening process, is it something that is all over the country, in some parts of the country? How is it on the ground?
Thank you very much. I want to say that the government has put a lot of effort and also collaborated very well with the private sector, what we are calling public-private mix in various counties and even at the national program. Initially, the light microscope, the microscopy was actually widespread the countrywide, including the fluorescent microscope. But of late, we're having a new test we are calling a gene expert, which is more specific and more diagnostic. We are able to do these tests. Each and every county has got at least more than one gene expert machine, and this machine are able to run loudly within the county. And the test is a good innovation because it is specific for the mycobacterium we talked about infecting the human race. So it is across. And the national TB program is in the progress of adding even more machines to the national and even to the county level, so that the machine will be able to tell us whether somebody is having actually tuberculosis or not. Of importance on these tests, apart from telling us that you have tuberculosis, it is able to tell us whether you're having a resistant bug in your system. Yes.
And Dr. We've talked so much about testing for TB.
Yes.
Kindly expound for us. Is there a cure for TB? And if so, why are we struggling with the disease even at this time?
Wow, that's a good question. Actually, TB, we usually tell people that tuberculosis can be easily diagnosed. It is treatable, it is curable, and it's even preventable. But sadly, it continues to kill more people because of what we call stigma. Many people don't believe that they can catch tuberculosis within their premises or even their families. So they are taking too long, and especially as men, we are taking too long before coming to the hospital. And this is what is being associated with a high mortality within our population.
And you've talked about all of this, and there's something I'm getting. With the symptoms of TB, they sort of move in a way like in tandem with the symptoms that we are being had concerning the coronavirus. Now, my question is this. When the coronavirus came about and visited us, unfortunately, in our country, how did the TB cases go? Was there like a serious upsurge, or how was it?
Yes, actually, when you look aloud, is that every department or even the ministry were actually affected by tuberculosis. And the Ministry of Health was not exception, including the National TB program. And really COVID affected us on the negative side. We experienced a drop of cases. When you look at the 2019-2020 cases, where we reported like 86,000 cases in the country. But during the COVID, we dropped. We had reported 96,000 cases, but we dropped to 86, which is a huge drop. And when COVID came, before COVID came, we were actually missing 40% of our TB cases every year. So if we are expected to get 100 patients, we are only getting 60. Now, when the COVID came, everything was disrupted, including the TB services. You remember most of the healthcare workers were shifted from where they were working so that they can be able to address the maniac of COVID. There was that lockdown. The patients were actually not coming. They didn't have the means of going to the facilities, the hospitals for testing. And even the resources were actually redirected towards COVID. And these ones cumulatively made us lose a chance to making more diagnosis among our clients. And we really missed tuberculosis. Remember also, COVID presents with similar symptoms and signs as tuberculosis, like a cough, difficulties in breathing, and even the hotness of the body. So many people are fearing to come to our hospitals because of stigma and also the fear. And this is what really led us to a huge decline in getting our cases. We actually experienced like a 15% case drop when you compare the year 2020 and 2021.
And the use of face masks, can it be maybe used as a way of curtailing the spread of the disease? And looking at the fact that right now it's not mandatory, it's not obligatory for you to have a face mask, are the measures being turned down on COVID like proving to be a challenge for the spread of TB currently?
Thank you very much for that. Actually, what we have realized is that when you look at the measures taken against the COVID, there was some positive aspect and also the negative aspect. One of the things is that you should realize that the mycobacterium is a very tiny bag. It's usually a very tiny bacteria that even the mask cannot protect somebody from breathing it. So the mask actually helped us to curb somebody coughing mycobacterium to the environment. And this one reduced the number of bacilli which are hovering on the environment, reducing the chances that somebody can inhale the same bacilli and get infected. But we don't have a clear data to show that actually wearing of mask has reduced this number of TB cases. Maybe the cases dropped not because of the mask, but the failure of the patients coming to be diagnosed. Because currently, because I'm still in the practice, we are diagnosing people who have been very sick of tuberculosis. Some actually coming like just coming to die to our hospital sundry. So we still have tuberculosis in the communities, and even COVID, we are not out of the hook. So we really, and our minister talking about putting on our mask, especially where we are having a congregation, where we are having many people overcrowding. It is also important to put a mask, and giving us more information about tuberculosis and other airborne diseases like COVID.
And now a question of concern. There was a lot of skepticism when we were actually trying to test people for COVID and all of that, with worries that it is painful or the otherwise. Could you just make it clear? Is getting screened for TB painful in any way? There's when the media took over the responsibility of awareness, they did a good job and guys were able to see. But unfortunately, where the procedures which were being used to collect samples for COVID looked to be like torturous or painful. Unlike for tuberculosis, where we request you to produce your sputum. Actually, you cough, you produce your sputum, and you forward it to the laboratory. When you come to the laboratory, you just insert it to the gene expert machine, which processes the results. Within 3 hours, you'll be able to get your results. So testing for tuberculosis is actually the easiest test which can be done. It does not involve a doctor or a nurse or a clinic officer coming into your system to get the sample, unlike in COVID. And Daktari, That's all the time we had today. And we are grateful that you, you joined us for this interview on World Tuberculosis Day. Thank you for making time for us, Dr. Franklin. And
thank you so much.
We do hope that everything will be on point, because it is very, very necessary to actually be concerned on the matter of tuberculosis, being a day that we are marking to commemorate and to actually highlight and create awareness concerning the disease that is worrying and has taken a lot of people down. And with that, we take our short break here on KUTV Primetime News. Stay tuned. We'll be back with more news.